Welcome to the 2019 American Association for the Advancement of Science webinar series called Scientific Collaborations with Human Rights Organizations. Today's topic is measuring change in social norms within gender-transformative programming. This discussion will concern work sponsored by CARE in its Tipping Point initiative. These webinars are a project of the Science and Human Rights Coalition of AAAS. The project team includes both social scientists and evaluators of human rights programs. Previous webinars in our 3-year series include critical steps and innovations in program evaluation. They are all archived at the AAAS website. A link will be available at the end of this webinar, and we warmly encourage you to look at the archives. They are very rich and very valuable. This year, we wanted to showcase the varied ways that scientists, engineers, and health professionals can and do collaborate with human rights organizations. Today's project from CARE examines their social norms analysis plot, SNAP framework within the context of promoting the rights of adolescent girls. The SNAP framework is a practical guide for translating social norms theory into useful ways of understanding and detecting shifts in social norms. I am Mindy Reiser, a member of the project team and a sociologist by training. I've had the opportunity to work in a number of developing countries, and I know how critical the work of CARE in looking at social norms and discovering and implementing creative ways of enabling change in areas that are really vital to the well-being and future of girls and women. Let me now turn to our speaker, who will describe in great detail what has been going on. Her name is Anne Sprinkle, and she is Project Director for Tipping Point at CARE. Anne has over 9 years of international development and humanitarian experience all over the world, in Latin America, Africa, and the Middle East and Asia. And she's worked with local, faith-based, and international humanitarian organizations. Anne earned a master's in international development at George Washington University before she joined CARE in 2015. She has a diverse technical background encompassing research, analysis, and programming on gender, gender-based violence, resilience, and sexual and reproductive health. Anne will be delighted to answer questions, and you will have the opportunity to pose them if you turn to the question box on the GoToMeetings dashboard. And will also, I'm sure, be happy to answer questions by email following this presentation. So now let me turn to Anne.
Thank you so much for the warm welcome, Mindy and team. As Mindy said, my name is Anne Sprinkle. I'm the project director for CARE's Tipping Point initiative. I'm happy to answer questions at the end of my presentation. I'll also put my email in the chat box if you'd like to reach out for resources or a dialogue around this work. So the Tipping Point initiative, just to give you a bit of a background, it's a multi-country initiative addressing child marriage by focusing on its root causes. We see child marriage as an act of violence, so we enable girls to assert their rights, we help families and communities to support them, and we influence policy to sustain that change. We do all of this through community level programming in Bangladesh and Nepal, where you can see on the map. We do evidence generation, as well as multi-level advocacy and influencing at national, regional, and global levels. You can see that our initiative has 3 phases. The first phase was rooted in deep formative research on the root causes of child early and forced marriage, what I'll be calling CEFM, in both countries, in both Nepal and Bangladesh. I'm going to talk to that formative study in just a moment. We used that formative study as the basis of our activity design in the first phase, but that phase was quite iterative in that we focused on girls and communities' own ideas for addressing issues around CEFM. We piloted those ideas and activities, and then we learned from their successes and our challenges implementing them. We're currently in the third year of phase 2, that middle phase. So we've launched a much more structured implementation package that's rooted in our learnings from phase 1. And then we've paired it with a 3-arm cluster randomized control trial, or RCT, in both countries. So phase 3, beginning next year, is meant to use this learning experience and evidence to make an impact on the discourse surrounding child early and forced marriage and girls' rights via influencing advocacy and scale. To give you a little bit of an idea about where we implement, in phase 2, we have about 6,000 direct participants spread over approximately 60 remote villages. First in the Terai region, or the lowlands of Nepal, that borders India, and then Rangpur, Bangladesh, which is in the northwest of the country. Then in Nepal, the communities are more mixed, including Hindu and Muslim communities, as well as socioeconomic class and caste. So for instance, some communities are heavily Dalit. Bangladesh is a bit more homogenous, as Muslim communities are much larger and more common. And then finally, I'd just like to highlight our partners that we work with in both countries. They're at the bottom right. We fully implement at village level through our partners and their staff, which is vital to our engagement with communities that we partner with. So that includes having staff from those areas that know and understand the needs of those communities. About the outcomes, or the outcomes that we seek with Tipping Point, we focus, I like where we and how we focus, or just the slide before that, yeah. Our community level implementation with the target group that we work with. You can see the target groups at the bottom: adolescent girls, adolescent boys, their mothers, their fathers, community and religious leaders, and influencers. There are 5 different outcomes mainly that we're seeking. We work with girls to build their critical awareness of gender and rights. We want to strengthen their confidence, skills, and social capital for making progressive choices in their lives. We also work with parents, focusing on the way that they value the voices, opinions, and aspirations of girls. We seek shifts in social norms related to marriage that are changing to be supportive of girls and against early marriage. And I'm going to go into the social norms that we focus on in the coming slides. We also aim to strengthen networks, solidarity groups, and organizations' collaborations to take action for girls. And finally, we invest in continuous staff reflection and transformation through critical reflective dialogue on attitudes, beliefs and perceptions about gender, sexuality, and power that leads to practices that model anti-oppression in their lives and in communities. I just want to really quickly highlight that looking at ourselves and the impact of our values and our practices, it has an impact on our professional work. So doing this type of staff reflection and transformation, CARE views it as vital to not only building our own capacity to do this work in communities and have difficult conversations, but it also makes our work more credible and authentic. Let's go to the next slide, thanks. Before we dig into the methods of the STAT framework and social norms change evaluation, I want to cover a few really quick basics, starting with the concept of social norms. Social norms are implied or unspoken rules, and they directly relate to our behavior and that we do what's expected of us and what we would be approved by others. So a really good example is standing in line. We stand in line not only because others do so, but also because it's expected of us. And finally, others would disapprove if we cut them in line. So standing in line is a social norm, and those are kind of the components that create that norm. So at the beginning of phase 1, we completed, like I said, the deep, thorough formative analysis. We called this the Community Participatory Analysis, or CPA, to understand both the vulnerability to CEFM and its drivers in contextually specific regions of Nepal and Bangladesh. But it was also designed alongside our partner organizations. We really focused on a collaborative approach between our country teams, our partners and communities, down to field level staff, and then finally our consultant team that helped us with data collection and analysis and building those tools. The CPA study used purposive random sampling within 8 districts in Nepal for data collection. We included an average of 90 households per village and 159 households across 13 villages in Bangladesh. So that totals about 250 households sampled across both countries. We use 6 different participatory data collection tools, ranging from social mapping to seasonal calendars to a visioning exercise. But they were participant-driven participatory tools. And the social norms on the slide that you can see on the right were identified by the CPA, and some of our key interventions address these among other factors. Most of these relate back to issues of family honor, and while they are here formulated as social norms related to adolescent girls' behavior or actions, it's really important to note that there are also social norms influencing parents' behavior in terms of how they restrict adolescent girls' mobility or interaction with boys as a way to conserve family honor. So just to go through a couple of examples, giving and accepting dowry was a big social norm that we sought to understand, especially connection between groom's family honor and the dowry amount, or girls' age impacts dowry amounts, increasing as girls age. Then there's also a lot of things about being a good parent, because we all want to be good parents to our children. We found that in these contexts, being a good parent means having tight control over girls' presumed sexual purity. So behaviors by parents such as restricting their mobility and physicality, so they're restricted to the home or just going from home to school, strict separation of girls and boys, no platonic friendships between them are allowed, because that could bring shame to families. Parents also see eve teasing. This might be a regionally specific example that I can explain, is bringing shame to families and restricting mobility rather than confronting eve teasers. It's a form of harassment or street harassment as well. And then prioritization of boys in access to education or income generation. So girls are assigned to household labor as their achievement in school in particular doesn't really affect family honor or enhance family honor. We have found out a lot about future gender roles, boys and men's and their parents, valuing meekness in girls, their youth, their fairness in future daughter-in-law. And then parents prioritizing presumed sexual purity over access to education. So all of these things you can see as I'm talking about are related. Finally, just one note talking about social norms. Although working on social norms in a targeted fashion is not completely different from many approaches that organizations take for social and behavior change, it does, social norms integration does require tweaking of some activities that many of us are already doing. So in many contexts, social norms are a critical driver of child early and forced marriage. However, it is one piece of the puzzle. It is not a silver bullet solution. And we see it as a complementary strategy in combination with others. So I'm focusing a lot on it today, but it is certainly within a larger package that we're discussing. The particular types of social norms driving CEFM vary from context to context, so it's really important to take time to understand what they are in order to develop targeted activities and strategies that will be successful in your context. So now that we know a little bit about social norms and the ones that are at play in Nepal and Bangladesh where we program, I'm going to discuss how we started to learn and evaluate the shifts in these norms. So CARE's Social and Norms Analysis Plot Framework, or the SNAP framework, defines components of social norms upon which evaluation tools are built, allowing the evaluator to assess the strength of a particular norm in the ways that it may have shifted. So you can see the components that I'll talk through. So the characteristics of the norm, the strength of each of those components of a norm, and then how it may be shifting. So the first 3 components that you see, they're drawn directly from social norms theory, and they describe the nature of the norm in a given context. So empirical expectations are what I think others do. Normative expectations are what I think others expect me to do. And finally, sanctions are anticipated opinions or reactions from others. The other 2 components of the SNAP framework further characterize the strength of a norm and questioned in its current state. So sensitivity to sanctions, how social sanctions influence behavior, and exceptions, under what circumstances it's considered acceptable to deviate from the norm. And the SNAP framework helped guide Tipping Point's understanding of the nature of norms related to gender equity and child marriage, how they're shifting or weakening, or how they're remaining fixed. For instance, if we see a number and type of exceptions expanding, like the number of exceptions expanding or the type of exceptions expanding, then the norm is thought to be weakening, or there might be cracks in that norm, as we call it. To collect data on social norms using the SNAP framework, many researchers and organizations have started using vignettes for social norms measurement in general, but we use it for SNAP as well. So vignettes tell short fictional stories that display a norm and then ask questions about its characteristics or components, the ones I just covered. And the stories themselves and the accompanying questions help us understand people's perceptions about others, not individuals' actual behavior. That's a key difference when we're talking about social norms. Once we develop the vignettes, it usually involves quite a bit of work with our field level staff and contextualization and then some testing. We use those vignettes in focus group discussions, or FGDs, and we do it in homogeneous groups to understand further the specific perspectives of that key group. And the questions you can see at the bottom, the example questions, are examples of how we unpack norms and identify how they're changing by, like I said, identifying the possible cracks or weaknesses. You can compare answers across time. So you can do a focus group discussion with a vignette at the beginning, at the end of a project, or baseline and end line. Or you can also ask participants to reflect on changes that they've seen or experienced over time. And yeah, like I said, this is an increasingly common approach to understanding and measuring social norms change within the development field. So I'd like to highlight a learning, but also a complementary methodology that also kind of was based on SNAP. For tipping point phase 1 and the phase 2 evaluation, we found another format to be a bit more useful than vignettes during pilot testing. So we did use vignettes, but we also used a complementary method called a norm by norm guide that is also a focus group discussion guide, but it's structured differently from the vignette. First, I'm going to tell you about the guide, and then I'm going to tell you about why it worked better for us. So again, for norm by norm data collection, we use purposive sampling. So we did not only use participants from the quantitative survey sampling in the baseline of the RCT, in the phase 2 RCT. There might have been some overlap between survey participants and qualitative participants, but that was not intentional, partially because the qualitative sites were chosen by our country office staff to provide a diverse set of respondents. So when facilitating an FGD, or focus group discussion, using the norm by norm guide, we focus on just one key social norm at a time. And then we focus in on the behavior of a girl or a parent or a boy, depending on the norm, in a community. And then we work through people's feelings about it, many times combining the normative and empirical expectations, because our own experience, as well as in other care projects, showed that people can't always distinguish between these components when talking about them. Some examples of the social norms we discussed using the norm by norm guide in Nepal and Bangladesh: parents investing equal or more resources into our girls' education compared to boys. We discussed girls' mobility, freedom to move around, girls playing sports, riding bicycles, love marriages, intercaste marriages, and girls speaking out and sharing their opinions. So why do we use this instead of vignettes? Our research partners field tested all of these tools before the baseline, for the phase 2 baseline, and we found the norm by norm guide to just be more useful, especially with boys and fathers, because they were not readily able to relate to stories with girls at the center as the vignettes. And so you have to come from a perspective of what do you think should be done for the girl in a supportive fashion. And that's a finding in and of itself, that boys and fathers were having a hard time relating to a story that puts them in that position. And the norm by norm guide made this conversation more specific and to talk, it allowed them to talk from their own perspectives. But we want to be careful, because we don't just want to use questions about what would you do specifically as an individual, because again, that's not talking about norms, that's talking about individual behavior. We need to be careful about diverting to personalized opinion. That takes us away from a reflection on norms. So it's certainly a balance when, and it really requires pretty advanced facilitation by our research partners and staff at the field level. So to give you an idea of how you can use SNAP and methodologies besides focus group discussions, I'm going to tell you a little bit about how the SNAP framework helped us build tools and structure analysis of norms underlying CEFM via Photo Voice and SenseMaker, 2 separate methodologies. You can see the description of the methodologies on the right, and we answered various questions using multiple methods like Photo Voice and SenseMaker. And what's important about both of these methodologies for us is that they center the voice and experience of girls in their communities. So there's a quick description on the right of these methods, but we also have our methods briefs that describe the process in detail, and I can provide links to those later on in the discussion. But I want to highlight how we structured each methodology and its data analysis on SNAP's components to answer evaluation questions. So an evaluation question was, what has changed regarding what people think others expect them to do or how they expect them to react in relation to a specific social norm? So for instance, girls were prompted to take, using Photo Voice, they were prompted to take pictures of what has changed in their lives. It's a pretty open prompt, not very specific. A girl took a picture of her underwear drying in the sun to reduce bacteria and infections after her menstrual cycle. And she explained that now she felt comfortable airing her underwear in her family compound in the light of day, not just because she understood the significance of hygiene management. She had the knowledge and the skills, but she talked to her brother, mother, and father about this very normal process and that shouldn't be hidden away due to shame. We also asked, have people's willingness to go against norms changed, even as they're expecting received sanctions? And what have been some of the actual sanctions in communities? You can see in the picture on the left, a girl is confident to ride her bicycle around the village. This is partially because she knows she won't be yelled at or harassed as much, but that increases her mobility and then also decreases the harmful consequences of doing something only boys used to do. We also asked a little bit about what positive deviants and how they're faring. Are they seen positively? So the next slide, we have just some highlights of the method's ability to uncover some nuances and how social norms are shifting. I'm going to highlight a couple of findings on this in the next slide. For dowry expectations, there were also there are potential signs that economic considerations that families make in the process of marrying children may be shifting. Parents provided new justifications or different justifications for delaying marriage based on reducing ceremonial costs and lower dowry prices when girls are educated or they're earning an income. So the sanctions for around dowry and around marrying are weakening. And they're also categorized as acceptable or expected under certain circumstances. For expectations of girls' worth, parents grew increasingly supportive of sending their daughters to school. They prioritize school attendance over household work. That impacts the entire family. And they're doing this knowing that they're going to receive feedback from those around them, from their neighbors or their extended family. Parents also indicated that they had begun to give more value to girls' ability to be self-reliant, make decisions for herself, play a role in the community. Boys advocated for girls in their communities by participating in street dramas and child marriage, dowry violence, and other issues. So again, girls and boys being active and vocal together in open public spaces. Finally, the connection between girls' sexuality and family honor. Girls faced social approbation through gossip and criticism of their non-traditional behaviors, but with the support of parents and each other from their girls' collectives, they largely disregarded this, and so they demonstrated resilience in the face of sanctions for behaviors outside the norm. And then the possibility of relationships with boys and elopements continue to animate fears by parents of losing family honor, but at the same time, it became socially acceptable for girls and boys to mingle publicly in the project's meeting spaces or for project purposes. A couple of more findings. Girls' limited mobility. Members of Tipping Point gained greater freedom to move around the village, like you saw with the girl on the bike, playing sports outdoors, working with boys to organize community events. And among girls in tipping point groups, 2 barriers were mentioned much less frequently in the evaluation focus group discussions as compared to the original CPA findings, which we used at baseline. So first and foremost, girls' freedom of movement within the community and the burden of household duties. They were mentioned much less frequently. And this suggests some improvement in girls' mobility and sharing of household work by brothers and other family members over the course of the project. Some important expectations of future gender roles. Boys began taking on more household work for reasons I just discussed, and girls took on visible roles leading and organizing community events that challenged traditional gender roles and supported girls' rights. And then in those spaces, they're expressing their opinions and advocating for girls' rights vocally. And girls' expectations for marriage and the ideal age of marriage evolved into wanting a later marriage to a man who will share daily household chores. There was some normative diffusion from the project outward into communities, but we weren't able to measure that quite as closely. And then finally, it contained little information on sexual and reproductive health. So members of Tipping Point's girls collectives in some communities valued learning skills from Tipping Point on menstrual hygiene management, like I mentioned, alongside some education on sexual and reproductive health, family planning, and importantly, sexuality. And so I just want to note, finally, that oftentimes girls and other participants were either less sensitive to sanctions or exempt from those. So you could see participants and non-participants having different experiences throughout our evaluation. So what did we learn? How did we shift and adapt from this learning for phase 2? I'll quickly outline this, as well as promising practices from the field of girls' rights and CEFM instructed and informed our phase 2 design. A few adjustments were made, increasing our focus on the norms that we saw shifting. So mobility and dowry, we knew they can shift. So we made sure that we addressed those head on during sessions with all groups, not just girls. So girls, boys, mothers, fathers, and religious leaders and government officials. Now in phase 2. In addition to those sessions though, they take place in safe spaces for reflection and usually within homogenous groups. But we also saw the power of public facing events. So when girls are centered their own collective action and leadership beyond group level platforms by advocating for themselves at community level, being vocal, being visible, we saw how powerful that could be. And this has been borne out in a couple of different ways. In phase 2, we now have a much more structured girl-centered movement building component. So girls don't just learn about public speaking and activism in their collectives, in their groups, but select girls are chosen to learn about and have mentors for movement building specifically. This leads to them developing their own agenda and ways of addressing normative barriers at community level. So when girls design, they budget, they coordinate for these events, they're not just gaining those skills and the confidence to do it and pull it off, but they know the safest and most effective strategies in their own context. So that helps us mitigate potential backlash, but it also helps them gain allies in the process. You can also see that we're addressing the control of adolescent girls' sexuality more head-on in phase 2. And this meant structuring sessions to discuss it in safe spaces with all of our participant groups, including fathers. So we talk about sexuality with fathers. This, like I said at the beginning of the presentation, requires us to prepare ourselves and our staff. So we do critical reflective dialogue on sensitive issues in our own lives, but we invest heavily in training and capacity building for facilitating these tough and really sensitive sessions. So you can see here our phase 2 theory of change, and we've adapted it to reflect this learning. It's also built on CARE's gender equality framework. To achieve gender transformative change, CARE sees the need to see changes in agency. So that's assets, knowledge, skills, on a personal level, on individual level, confidence, self-esteem, aspirations. We also want to see changes in relations, or the power of relations through which people live their lives. They can build collective agency. These relations can support intimate relations, social network, group membership. And then finally, we also need to see changes in structures. by engaging formal structures to shift discriminatory social norms, customs, values, and exclusionary practices. And it also obviously encompasses laws, policies, and procedures and services. And the changes you can see depicted in the theory of change are directly linked to our results framework, which identifies indicators to measure norm shifts in our RCT evaluation. So I'll just give you an example of how we do that through a couple of indicators. A larger outcome that we have is weakening of gendered social norms that limit adolescent girls' lives. If you go down further in our results framework, we measure the output at output level, increase collective action by girls, boys, and parents to shift norms. So you can see kind of center bottom collective action. And then below that, getting more specific, expectations of girls' worth. You can see adults allow girls to engage in behavior that challenge social norms, such as collective action, like I mentioned. We measure control over girls' sexuality and its connection to family honor. You can see girls discussing decisions about her marriage and talking with an adolescent boy as well. We also measure if respondents are rejecting promising marriage proposals. Even if a girl does not attend school or is perceived to challenge family honor, are they rejecting that? We measure expectations of future gender roles. So you can see a depiction here of behavior by parents and adolescent boys in support of girls' equality and rights and equitable treatment of sons and daughters. You can see that at the top left. And then gender equitable behavior, again, top left, workload sharing, as well as the bottom right, the clinic scene. That's a father with their young child at the clinic, which is almost exclusively a woman's role to take care of the health of their children. A last example is how we depict and measure girls' mobility. She's walking around her village, she's riding bicycles, she's playing sports. Finally, after 6 years of building learning and monitoring and evaluation systems and tools that center social norms, we want to share a few reflections for people implementing these programs, but also the MEL systems that they'd use. First is framing social norms for adolescents. It's really helpful, we found, to ask girls to identify a good example from their community, particularly when discussing norms one by one. So you can probe about the sanctions of each and their willingness to go against norms as well as exceptions. We found it really helpful for ourselves and for our staff and our partners to know the basics of social norms and how they're constructed, because we don't want to confuse social norms or assessing social norms with assessing individual behaviors or attitudes. We also use multiple interactive methods. So for instance, I mentioned photo, voice, and sense maker for our phase 1 evaluation, and for our phase 2 RCT, where it's a mixed method RCT. But we really believe that multiple different types of methods that center the voice and experience of girls can provide really rich, nuanced data and capture norms change from multiple perspectives. And then finally, I think, which is true for programming as well, methods should recognize that girls are experts in their own lives. Yeah, and before I get into questions, I just want to say a quick thanks to our Tipping Point Nepal and Bangladesh teams. Over the last 6 years, they have been instrumental in developing and rolling out these tools and approaches with communities. They really drive our learning at a national and global level. And most importantly, they connect theory with practice, which I think is always something really important to do. Here's a picture of our team in Bangladesh with our partners. They are currently rolling out a really comprehensive monitoring system to help us continually reflect on implementation and learn as we go. They've been incredible, and they've been instrumental to all of this learning that I've just presented. So thank you to them, and I'd like to open the floor to questions and comments and reflections if you have them. Yeah, and you can see there's a question box just for that.
Hi, Anne, can you say something about your own direct role in this? Did you go on site? Did you do the training of the facilitators? Did you sit in on the focus groups? Give us a little bit more of your direct personal engagement.
Sure, yeah, I've been with Tipping Point for about a year now. And so, like I said, this is a compilation of 6 years of kind of learning and implementation. But I mean, we have a team, we have a global team of about 4 or 5 of us. We all have our different roles and responsibilities, but we always have our MEL specialist, monitoring, evaluation, and learning specialist, who plays a huge role in creating the monitoring and evaluation system, specifically the monitoring system, and helps create the tools, formats, guidelines, and train staff on how to use the monitoring pieces. For the evaluation specifically, like I said, phase 1, we used a consultant group to work with us to do that. And so there was mixed facilitation and training between our global team and our consultant team. For the phase 2 randomized control trial baseline, we have 2 research partners. We have a research partner in Bangladesh, ICDDRB, they're a well-known research institution. And then we partner with Emory University in Nepal, who works with IDA, a local Nepalese research organization. And so the training for those data collectors is done largely by the staff within those organizations, but we also always provide support, particularly when it comes to understanding gender and power and the social norms at play in these communities that we're trying to understand through the tools. So that's everything from presenting like key concepts to presenting the nature of a norm and how you would ask the question in that local language. So almost all that training is done by our local staff in Bangladesh and Nepal, but it's really important for data collectors to understand both our experience and our expectations and the nuances of the norms within these communities. So that's always really helpful. So I coordinate that type of support and the type of training that they do. And then for the training of our staff, like I was saying, for critical reflective dialogue and staff transformation on these sensitive issues, we work together as a team at global level in coordination with the national level staff to build those trainings that are contextually specific, as well as following kind of like the principles and promising practices that we have at global level for those models and for those training manuals. So I see some questions kind of popping up in the chat box or in the question box. Thanks so much for those. There's a question about how you engage people in the project who are reluctant, such as parents who may not want to discuss norms or change. That is a great question and something that we deal with every day. So as you all know, I mean, parents are busy, right? And especially in these contexts, fathers are many times outside of the household doing different types of work, so they're not nearly as available as adolescent girls and boys who we can usually engage after school or on Saturdays. And so parents take a specific approach. So for instance, mothers, we usually find a specific time of day that's good for them. Many times that's after lunch. So they've taken care of all of the household chores in the morning and done the majority of the cooking. And so there's a small window in the afternoon when we can engage them. And usually we find mothers are really excited to be involved in these groups and these discussions and dialogues. No matter how sensitive they are sometimes, that can be difficult with their participation. And that really relies on high quality facilitation skills. Like I said, we practice and kind of cultivate over time. With fathers, it is, again, it's finding a time that works for them to get them engaged in the activity. And it can require, like I said, really skilled facilitation to talk to fathers about these sensitive subjects and engage in participatory dialogues about them. And when I say participatory, I sometimes mean games. These are interactive activities that sometimes parents think are more relatable for children, but with skilled facilitation, they become really interested and really engaged and really enjoy the sessions. And then just not wanting to talk about change and not wanting to talk about norms, like I said, sensitive issues, requires skilled facilitation and having that experience yourself to talk about sensitive issues. But again, we come from a perspective of not teaching. We as care staff or partner staff are not coming with the answers. We are asking you to reflect on your experience and your reality as opposed to telling you what's right and wrong. And that can open the doors to a lot of reflection and growth and dialogue around sensitive subjects. And then I see a question about how we chose the key norms to focus on within phase 1's formative research, based on a literature review or otherwise, and how we decided which behaviors to choose beyond that. So the phase 1 community participatory analysis, it was quite open. Obviously, we had some background in the context of those communities in Nepal and Bangladesh. There's also a wide kind of body of research on the drivers of child early and forced marriage, so we drew quite a bit on that as well. So it was a combination of how we addressed those through our tools. And like I said, the tools were pretty open. So when you're talking about your aspirations, that can tell you a lot about what you've been told in life, what you've been told to aspire to, and that can give you an idea of kind of the things that are driving the underlying causes. Yeah, let's see some other questions. Given the generally subjective nature of analyzing qualitative data, are coders blinded to group in the RCT evaluations? How does coding work? So coding is done completely by our local research partner in Bangladesh, and then it's done by Emory University in Nepal. So coders in Bangladesh were able to code the data in Bangla, so in the local language. And blinded to the group, no, they're not blinded to the group. They know that it's a girls group that they're coding. And then same thing in the English, the transcriptions are done in Nepali, then they're translated to English, and then the coding is done. And the coding frameworks were built together with us. So each research partner developed their own coding framework, and then we provided feedback on that. And then there were multiple stages of discussion between us. We would have calls between CARE global level, as well as CARE Nepal or CARE Bangladesh, and the research firm or research partner. And we would discuss how their coding and analysis is progressing. So we would have our social norms measurement expert, along with our MEL specialist, along with a CARE Nepal staff member, hop on the phone with Emory to talk about what themes are coming through, how they're using the coding framework, which codes are not coming out as strong, which responses are having trouble coding. That was a pretty participatory process over the summer. That was really helpful for both our learning of how these tools are being rolled out, but how others use them as well. Really helpful in clarifying different concepts. Can you say who you worked with on SenseMaker? So SenseMaker, we worked with a consultant. The SenseMaker approach, as you can see, is copyrighted. So you have to buy a copy of or lease of the software and their analysis software as well. And that involves quite a number of steps, and it can be somewhat expensive, but you almost always work with that company or with a consultant that knows how to use that methodology. But yes, you do have to pay for that. I see a question on, can you describe a bit how the project team got clarity on what is a social norm versus individual beliefs? What steps did you take to differentiate social norms versus individual behaviors? Yeah, again, that comes down to the facilitation of the tool itself, the FGD guide, whether it's a norm by norm guide or a vignette. Really important for data collectors to understand the difference between individual behaviors and social norms. So we're not looking for people to say, this is my perception, this is what I believe, this is what I do. We're looking to them to reflect on what is acceptable or normal within their community, saying, yeah, it would be normal for a girl to be yelled at by an older man if she's riding her bicycle, not I was yelled at, or I would yell at a girl, or I would harass a girl if she was doing that. You're right, that's a really important distinction that doesn't always get uncovered. It's also a discussion during analysis. We're able to talk through with our research partners as they're coding the difference between those two things, which is really important. What age do you consider an adolescent who's included in this group? So for phase 2, it is 12 to 16 12 to 15 or 12 to 16, depending on the country. So we're not working with very young adolescents, which we usually categorize as like 10 to 12 or 10 to 13 or 14. We're 12 to 16, and we're not dealing with older adolescents that go up to 18. Those are not within our groups. We're looking at a pretty specific age range. Great. Question from Pop Council. Can we talk about the difference between younger and older adolescents? Excuse me, to start? Yes, of course. Great point. I think it's really important, and a lot of people working in adolescent sexual reproductive health and other adolescent-specific programming, I think we really know and understand the importance of differentiating between different groups of adolescents, especially by their age. So for instance, adolescents that go over the age of 16, especially girls, they're much more likely to be out of school and or married. And married girls obviously have a vastly different set of needs and priorities in their life. The type of information that you give them about family planning, their ability to access those services, and then their ability to use family planning is completely different than an adolescent aged 12 or 13 who may still be in school, still lives at home, and they may, and it's a completely different conversation about needs. And so I'd say we tailored this curriculum for girls and boys specifically for this age range in a couple of different ways. Not only the type of language that we use, the type of games or participatory activities that we use, the time of day, the stakeholders that we engage as well. So again, the stakeholder, like other groups outside of girls, are adolescent boys of the same age and their fathers. If we're working with adolescent girls or ever married girls, as we call them, CARE has another great program called TESFA that works with ever married girls, but they engage their husbands specifically, as opposed to engaging men like their fathers, because they're no longer living in their father's houses, and other types of community leaders along with their husbands that might be more of a peer group rather than a stakeholder group or an influencing group for those men, if that makes sense. Expecting results. Yeah, our baseline is going to be published coming up in January. So analysis and report writing are happening as we speak. We'll be publishing the results of our baseline in the coming months, so definitely look out for those in early 2020. And then, I'm sorry, I can't see the rest of the question, talking about the reliability of, yeah, sorry, that one's cut off a bit. Yeah, another question about married adolescents considered children or adults. Excuse me, great question. In their communities, married adolescents are definitely considered adults. They are not in their parents' home any longer. Girls are expected to become pregnant and bear children quickly after marriage to prove their fertility as well as their husband's fertility. It's really important. So it's a big shift in how these two groups are viewed. I mean, they may be the same age. You may have an in-school girl that is 16, but she's not married. She is seen as a child, becoming a woman very quickly. But if she's married, she has a whole other set of responsibilities, roles, and expectations on her. Let me see if I can take one more question in the last couple of minutes. Unless, Mindy, you have a question or a comment?
Okay, then. Let us give a hearty thanks to our presenter and Sprinkle of Care and all our project team sitting here beside me, Joel Erickson and Nate Weisenberg of AAAS, for their invaluable technical support. For assistance on designing and conducting project and program evaluations, we recommend gaining the aid of an evaluation expert at the beginning of the project, and we hope that by participating in our webinars, you will be the evaluation experts. As plans unfold for further webinars on collaboration between scientists and human rights organizations, at the end of this webinar, an online poll will appear on your screen. We urge you to take a minute to respond to it. We really need your feedback to improve future webinars. Ideas for webinars are welcomed, and your comments may be sent to Oliver Moles, the project team leader of this initiative. And his email is ocmoles, M-O-L-E-S, @gmail.com. We thank you again, and we look forward to your future involvement. And do feel free to send any emails to Anne, our presenter.
Thanks, everyone. I put my email in the chat box if you'd like to reach out for resources or more information. Thanks so much for having me.